Hey Brad, what are you taking a picture of?
I'm not taking a picture, I'm texting.
Why are you holding it that way?
I'm trying to prevent text neck.
Text neck? What's that?
Well, it's funny you should say that because it's a big problem nowadays with a lot of people. I mean, a lot of people have neck pain and posture problems because they're always on their phone texting. So the correct way to text is like this.
Wow.
Well, at least according to Dr. Alan Molina of the Heights, who I just got done interviewing.
Well, I can't wait to see that. But first,
The intro. Hey guys, it's B, and wouldn't you know it, we're here again with Dr. Alan Molina. You've seen him from other episodes, such as popping up on the surfboard and the couples workout, but now we're actually going into his true field of where he makes his living, chiropractic. So today we're going to talk about text neck. Yes, it's a thing, text neck. So, Doc, can you tell us what is text neck?
So Brad, before we talk about text neck and what it is, I want to actually show an x-ray of what a normal neck looks like, and then we can show you what text neck actually is. So everyone's head is focused down or looking down at a computer screen. So what we're starting to find now with people is a lot of people are coming out with headaches, sleep issues, pain in the neck, pain in the mid-back, and pain running down the arms, and that comes from losing curvature in the cervical spine. So if we zoom in over here and take a look at this x-ray, what a normal neck should look like is we should see a nice 45-degree curve, almost like a reverse banana. Now, the reason why we have these curves is when we have the proper curves in our neck, it allows the disc, which are the joints in between, not the joints, but the spaces in between the bones, to actually sit at rest and work as natural shock absorbers when you walk, when you run, when you sit down. So when we lose that curve, that's what we call text neck, and as that happens, that puts a lot of strain on the nervous system and actually closes down those disc spaces and the nerve endings that come out, and that's how we get pain in the neck and down the arms and headaches.
Well, that answered my next question is, what is the impact to overall health? But you just heard it. That can cause sleep issues, pain, and numerous of other things. So then, obviously, it looks like we've got another x-ray here of what it looks like.
So if you guys take a look at this other x-ray right here, this is a young 19-year-old gentleman who was coming in with sleep issues, migraine headaches. So as you can see right now, in comparison to the normal x-ray, this doesn't even look anywhere close. So now what you're starting to see is loss of curve in the cervical spine. So this particular individual is actually measured out at 16 degrees out of 45 degrees, which is a 62% loss at 19 years old. And this is what I'm starting to see more and more with young patients here coming into my office. Another thing that also contributes to neck pain and also that is associated with text necks is something called forward head posture. So if I come back down to this normal x-ray right here and this little indentation, this is where pituitary gland sits in the brain. If I was to draw a line straight down, it crosses right over there in the middle of the vertebrae right here. So as you can see over on this x-ray where his pituitary gland sits, if I draw a line down, it's coming much far forward from the spine, and this is what we call forward head posture. So on average, the human head weighs about 10 to 15 pounds. So for every 1 centimeter that your head is coming forward is adding 5 extra pounds. So essentially, this young gentleman is holding 15 extra pounds, and that's why he feels so tight in the neck here and so tight in the upper back. Along with text neck, and something that's growing more and more, and what we're seeing more now is we're seeing this growth in this occipital horn that's on the back of the head here of young individuals. And the reason why this is because the head is so far forward and the loss of curve in the neck that the ligaments and tendons that attach to the back of the head here are always under constant strain, and they're pulling and they're starting to calcify. So obviously that's not cool. We don't want our kids to have a horn in the back of their neck.
So what is the overall long-term effect if it's not treated?
So long-term effect of having text neck is as this head starts to come forward, it goes into spinal degeneration, and more specifically degeneration of the disc. So as this neck is starting to come forward, these disc spaces, which are supposed to be nice and symmetrical and spaced out, what happens is they start to close down, and as they age and get into their 40s and the 50s and the 60s, what ends up happening is now they're going to have a negative curve, and then at this point right now, as that disc space lessens, arthritis is going to grow out the front of the neck here, and eventually when that disc is completely gone, then you're looking at $140,000 surgery, cervical fusion.
we talk about, okay, they're going to talk about cervical fusion, but what does it actually look like
Cervical
to that
fusion?
person? Not to the cervical fusion, but what does it actually look like as far as symptoms go in that range at the 40 and 50 side for not taking care
when
of
you
this?
start seeing I'll have patients come in and they're complaining about traveling pain. So, we all know what a muscular strain feels like. It feels achy and tight. So at this point right now, they're going to get electrifying feelings running down to their hands, down to their fingertips. You maybe get some numbness coming down there or somewhere in the middle back here as well. Because all the nerves that come off the lower spine control here, down the arms, all the way to the fingertips.
Oh, okay. So that sounds painful. All right. So what can we do to prevent that? What are ways we can go about preventing text neck?
So one way you can prevent text neck is, one, you need to set up your workstation. If you sit down at a desk, you can move your computer screen where your head is going to be coming up about 20 degrees. And also just give yourself a body check. Make sure your shoulder blades are back and you're sitting nice and upright and that your neck is in neutral. So it's actually odd for most people because when you actually bring the head back in neutral, it actually feels like you have a double chin. But that is actually what a 45-degree curve in the neck should feel like. There are also other ways here. These are called prism glasses. And what this does is it takes away from having your head down if you're reading at night laying in bed, or if you want to get crazy with it, you can hold your phone down below. But these prism glasses have these prisms that reflect down. So if I'm laying on my back, I can put something behind my neck to facilitate that curve of my neck, and I can read in a neutral neck position, and that's going to take away from a lot of neck strain.
And we'll go ahead and link those in the description below. But those are pretty cool. I just got my pair and I kind of like that. Okay, so the next thing is text neck. Obviously, we call it text neck or tech neck
Yes.
as far as the monitor goes. How would we go ahead texting in the right position in order to facilitate not getting text neck?
So if you have the opportunity and you can lay down, obviously you can just lay down and hold the phone in front of your face. If you're sitting down, you want to have the phone right in front of your face here, and you want to text at this point. So again, if you're having your shoulders up above your head like this, it's going to cause a little bit of tension in the upper back musculature. So if you want, you can just keep your shoulder blades back and down, keep your head in that neutral position. You can hold the phone right in front of you.
So if you're out in the coffee shop and you're seeing people text like this, no, they're not taking a picture of you. They're probably just a client of Dr. Alan Molina. So if you have text neck and have already gone ahead and been diagnosed, what can we do now at home? Obviously, one is go see your friendly chiropractor. Or two, what would be some things that people can do to relieve it at home?
So what's happening here is the soft tissue in the front of your neck is getting very tight and very short. So some things that you can do at home right now is there's a couple stretches. You can look them up on YouTube. You want to really stretch out the SCM, and that's going to help bring your head back. And then also the thing is, you want to strengthen these opposing muscles in the back, which are the deep neck flexors. So there's something called in training that we use is called reciprocal inhibition. That's when one muscle contracts, the other one's relaxing. So as we strengthen these muscles here in the back by doing various exercises with the chin tucks here, you can use the band. What's going to happen is those muscles are going to get stronger, and over time, this muscle in front is going to relax. So that's a couple things you can do at home in order to combat text neck.
All right, so you heard it here first, folks, right from the Dr. Alan Molina, and here at Champion Wellness of the Heights here in Tampa. So if you're out here in Tampa, come and see Dr. Molina. Otherwise, go talk to your friendly chiropractor. All right? Thank you very much.
Thank you.
We appreciate it.
You guys have a good day.
Stay motivated, stay weird, stay healthy.
All right, this is Dr. Alan Molina here with Champion Wellness Center of the Heights, and we're just going to show you a couple exercises for those deep neck flexors to help with text neck. So TheraBand, I'm not sponsored, so I'm not getting any money for this, but TheraBand makes a nice band called CLX, and you can see they have these little loops that go through the bands here, so you can put your hands. So for the first exercise, we'll just call this CLX deep neck flexors. You want to start with the band right behind the back of the crown of your head. And what's going to happen here is, just like we were talking earlier in the video, I'm going to extend the arms out straight ahead, and what I'm going to do is I'm going to put my head in that, making a double chin, and this is how the exercise begins. So when I'm doing this exercise, I'm going to slowly have my hands come back towards my face in a count of 3, 2, 1, all while maintaining that double chin, and then I'm going to extend back out. So for sets and reps, you want to do this daily. You want to do about 2 sets of 15 repetitions. All right, so the next two stretches are going to be one for the SCM here for the front of your neck, and the other one's going to be for the pectoral muscles. So I'm going to use the future Dr. Leonard here as my assistant today. So what we're going to do is we're going to stretch out the right SCM first. So the way I'm going to cue this and cue you guys watching this video today, so the first thing Veronica's going to do, she's going to take this palm and she's going to have her palm pointing forward. So at this point, she's going to bring this shoulder blade back and down, okay, and she's going to constantly depress this hand the entire time into the floor. With this free hand, she's going to take it and bring it back behind her back here. And what I'm going to do is I'm going to have Veronica cue. She's going to laterally bend her head to the left while she is forcefully pushing this hand into the floor. And as she's going already, she should be feeling a stretch. So what I'm going to cue her to do now is imagine that she's trying to look up and turn her chin to the upper part of the room. Do you feel that? Mm-hmm. Okay, so that's how you stretch the SCM. She's going to hold that for 5 seconds and do 10 reps twice a day. And that's a true 5-second hold. 1001, 1002, 3, 4, and so on. Every time you go for each rep, you want to bring that over to an area of light irritation, and in each rep you go, try to go a little bit deeper. All right, so the next stretch we're going to do to combat text neck is a doorway pectoral or doorway chest stretch. Now, the reason why we do this stretch is when you're sitting down or down looking at your phone, what ends up happening is your shoulders start to come forward, you start to round forward, so these muscles in the front get short and tight. So this next stretch, I'm going to cue Veronica here. What we want to do here, she's going to stand in the middle of the doorway and she's just going to put her arms right about here, where you can see this angle is about 45 degrees. At this point, what I'm going to have Veronica do, she's going to get into a split stance, so have one foot forward to the other. And I want you to back up just a little bit for me. But go ahead and have your right foot forward and bring your left foot back. Before we engage in this stretch, what I'm going to have Veronica do, she's going to squeeze her butt and she's going to go into a posterior pelvic tilt. And at this point right now, she's going to hold that and she's going to allow her body to fall forward. She's going to find that tension there. She's going to hold for a count of 5 seconds. And then she's going to relax and take all the tension out. At this point right now, she can go ahead and relax everything. And then we're going to cue her again. She's going to squeeze the butt, posterior tilt, and she's going to go forward a little bit more to an area of light irritation. So she's going to progress that stretch each rep.
Hey, Melissa, great job on getting your texting correctly.
I'm taking a selfie, man. What are you talking about? It's the best angle.
Oh, I'm sure it is.
No, seriously, that was a great interview with Dr. Alan Molina. What great information, the exercises. I know everyone out there is on their digital device hunched over like that, so thank you for that interview.
Well, and you're welcome, and thank you to Dr. Alan Molina of Champion Wellness of the Heights. And definitely take those words of advice, give those exercises a shot, and I bet you'll feel a lot better.
Yeah. And if you would like to see more videos on the posterior chain to help improve your posture, decrease pain, and have a better lifestyle, let us know. Hit that subscribe button, like it.
And the notification bell. But until next time, stay motivated.